Hello, and welcome to the Paging Dr. Cohen podcast with your host, Dr. Gordon Cohen, MD, PhD, MBA.
And so my goal is to make medicine as understandable as possible. No funny language, no complicated verbiage, just plain old conversation.
Let's call in the doctor.
Paging Dr. Cohen.
This is Seattle's Morning News. Dave Ross with Colleen O'Brien and Chris Sullivan. And there is good news on the COVID front, that being a cure for people who already have come down with the disease in Israel. Let's call in the doctor.
Paging Dr. Cohen.
Dr. Gordon Cohen, MD. And the doctors there have reported pretty dramatic results. Tell us about this study, Gordon.
The good news out of Israel is that they had 30 patients who had moderate to severe COVID-19, and they were given a treatment developed in Tel Aviv as part of a phase 1 trial. And this trial used what are called CD24 enriched exomes. And these are actually meant to treat a specific component of the disease that we've talked about, which is the cytokine storm. This is the body's reaction to the virus. And it's this overwhelming immunological response that causes the flooding of the lungs and the inflammation of all the organ systems that often leads to death. So in this case, they deliver an inhaled protein, the CD24 protein, to the lungs, and they found that it really attenuated dramatically the cytokine storm that occurs. And in fact, they cured basically 30 out of 30 patients and 29 out of 30 of them within just a couple of days. So it was a pretty dramatic response.
So this is something you just inhale?
Yeah, it's inhaled once a day for a few minutes at a time, and they do it for 5 days, and it directly targets the lungs, which is really the site of the cytokine storm. And it's really differs from other treatments, which, we're giving to the whole body. We're giving systemically and have a lot of side effects. This doesn't really have many side effects associated with it, it appears.
That's great news. On the vaccine, though, we have some news from South Africa where they found that the AstraZeneca vaccine is not as effective on the South African mutation as they would like.
Right. So the AstraZeneca vaccine has not been shown to be effective against the South African variant. What we do know, which is good for us in this country, is that both the Pfizer and the Moderna vaccines appear to be effective against it, less so than other strains.
Now, with the spotty supply, I know that people are wondering, well, if I can't get my second dose of the Pfizer, could I go with the Moderna? In other words, can you mix vaccines? Has that been studied?
Right. So it's a great question. And in fact, in the UK, which is one of the countries that's actually been hardest hit, they've actually been extremely effective in rolling out their vaccine. They've already vaccinated about 15% of their population, or about 10 million people. And one of the things that they're studying there is a new 13-month study where they're actually going to combine two different vaccines. They're going to try the AstraZeneca vaccine along with the Pfizer vaccine. And they're going to separate them by either 4 weeks or 12 weeks and try to see if there's some added benefit. Now, the reason that would be interesting to do is because it's two completely different technologies. And the question is, really, there's actually a couple questions. One is, if you don't have adequate supply of one vaccine in order to give a second dose of the same vaccine, can you substitute some other vaccine for it as your second dose? The other question then is there a benefit to doing that? Is there better coverage by doing that? And they're also asking, is there a benefit to spreading it out? Rather than having the two vaccines 4 weeks apart, is there a benefit to having it 12 weeks apart?
Now, the other question comes up. Well, I now know, I think, 4 or 5 people, including several in my own family, who have had COVID. The latest person I talked to who had it said, Dave, whatever you do, if you can avoid getting this thing, do it, because I was miserable. I had no strength, et cetera, et cetera. But there are people who still feel that the immunity that you get if you go through it is stronger than what you get from the vaccine. Is that true?
The actual answer is we don't know. And it's somewhat confusing because part of it may have to do with how severe your infection is. So if you have a mild infection, you only may develop a mild degree of antibodies, whereas if you have a more severe infection, you may develop a lot more antibodies. The other problem is that there have been reports and studies that have shown that the antibody levels are starting to fall within 30 days after getting an infection. So the real answer is we don't know about the overall immunity from getting the infection. However, with a vaccine, it's much more predictable because it's given to everybody the same way every time. It's been studied in an appropriate scientific fashion, and antibody levels, which are one of the markers, have been measured. And there's also longitudinal data following these patients that show that the vaccines are effective. There's not good data in patients who have been infected that have been able to actually measure antibody levels and then follow them in such a way to see how effective their natural immunity is.
Dr. Gordon Cohen, MD. Dr. Cohen, thank you.
Thanks, Dave.
If you enjoyed this episode of the podcast, please tell a friend, rate, comment, and subscribe on Apple Podcasts, Spotify, or wherever you listen. Stay up to date on Twitter by using the handle Paging Dr. Cohen, or simply send us an email with any comments or medical questions to podcast@pagingdrcohen.com. This podcast also supports the American Heart Association. Please visit heart.org and consider giving a contribution by clicking the Donate Now button in the top right corner. Thanks again for listening, and stay safe.